Gait control requires activation of nearly the entire nervous and musculoskeletal systems and is regulated by voluntary and automatic processes. Voluntary movements result from intentional motor signals traveling from the cerebral cortex to the brainstem and spinal cord. This voluntary process is always linked to automatic mechanism of postural control, including balance adjustment and muscle tone regulation, controlled by the limbic system, the brainstem, and the spinal cord. The cerebellum regulates the cognitive and automatic processes of posture gait control by acting on the cerebral cortex and the brainstem, respectively. Disruption of the neuritic axonal network and/or other neurodegenerative changes produce lesions either in specific areas or diffusely across the brain. Depending on their location, these lesions can alter corticocerebellar circuits, disconnecting brain circuitries between cerebellum, thalamus, striatum, prefrontal, and motocortical areas. This process leads to disruption of the signal going from the affected areas to the spinal cord, compromising movement and coordination functions mediated by the cerebral cortex, the brainstem, or the cerebellum. Electrical stimulation by active PoNS device delivers impulses to nerve fibers in the anterior part of the tongue, stimulating the lingual nerve, a branch of the trigeminal nerve, and the chorda tympani, a branch of the facial nerve. Tongue-induced electrical stimulation of these cranial nerve branches reaches the pons varioli, medulla, and cerebellum. Lingual nerve and chorda tympani stimulation promotes activation of selective nerve centers in these brainstem and cerebellar areas. This activation sends signals to associated target areas in brain cortical regions. In movement and coordination disorders, signal transmission pathways to the spinal cord can be partially or totally compromised, leading to impaired function. Repeated neurostimulation employs neural mechanisms that can offset abnormal activity of corticospinal pathways. Neural activation leads to neuromodulation, a process that engages physiologic compensatory mechanisms capable of replacing and/or repairing impaired neural pathways. Consistent neuromodulation can eventually help regulate function and regain control of movement and coordination. Neuromodulation induced by physical therapy may be mediated by non-selective activation of cerebellar areas, which can engage premotor cortex activity on the corticospinal tract to compensate, albeit partially, for the movement deficit. In a PoNS clinical study on multiple sclerosis patients with gait deficit, bilateral premotor cortex activity appeared to be preserved at baseline. Physical therapy performed with a PoNS sham device signaled, after 14 weeks of therapy, increased activity in the right and left premotor cortical areas, which eventually correlated with a meaningful but temporary gait improvement outcome. PoNS-induced neuromodulation is mediated by the neural activity of specific brainstem areas that send signals to the cerebral cortex. The consistent neurostimulation of selected brainstem and cerebellar targets promotes the activation of the left motor cortex as well as the activation of the dorsolateral prefrontal and cingulate cortices in both sides of the brain. Activation of these compensatory pathways may contribute to regulate gait and cognitive mechanisms for movement and balance control. Frequent and repeated activation of these cortical areas may lead to changes to defective neural mechanisms that fail to deliver functional signals to the spinal cord for control of movement functions. These adaptive changes consist mainly of generating new neurite axonal networks to replace or repair the canonical pathways impaired by the disease and compensate for the decrease or loss of function. The neurostimulation process that leads to neuromodulation and consequently triggers adaptive changes is associated with mechanism of neuroplasticity, namely, the brain's ability to compensate and organize functional activity in response to sensory input, neural activation, and/or neuronal signaling or functional stimuli. Over time, consistent engagement of these neuronal areas allows the brain to learn and employ those compensatory mechanisms that resulted from persistent neuromodulation. This process of physiologic compensation can, over time, rehabilitate corticospinal signal pathways and eventually maintain functional activity. Defective neural pathways that deliver the signal to the spinal cord for movement control are involved in mechanisms of gait function impairment. Evidence of a mechanistic correlation with clinical outcomes from 2 clinical trials in MS people with gait deficit suggests that consistent PoNS-induced neuromodulation in combination with targeted physical therapy can lead to the development of compensatory pathways. Consolidated adaptive changes compatible with neuroplasticity are likely to lead to sustained improvement of functional outcomes.